So this is one where instead of saying what the symptoms are, we'll show you what the problems are, and then you tell me what symptoms you think the person would have if they had this. That's a good answer. All right. Well, here we can see that the hyoid is pulled down in an abnormal way that we don't really understand. And we'll remove some of these structures here. And right away you can see that this styloid is making contact with the atlas. It's displacing the jugular vein there. Let's make that bigger. So it's not coming all the way across to the internal carotid, thank you Jesus, but it is coming almost completely blocking that jugular, and it is actually digging into it and poking it. And on the other side too, you've got the styloid coming in there, and this is with you lying flat on your back in the neutral position. As soon as you bring your head down, it's going to push this. Actually, I'll show you. It's going to push the atlas back, subluxate it. This whole thing pitches forward. Both jugulars are occluded and compromised, and the nerves sit right in through here. That's going to be the vagus nerve, the superior cervical ganglion, the internal carotid plexus, the pharyngeal branch of the vagus, the glossopharyngeal, the accessory nerve, the anterior ramus of the first cervical nerve, the hypoglossal, the stylopharyngeal branch of the glossopharyngeal nerve, the carotid sinus nerve, the carotid body branch of vagus, and the jugular nerve. So if there was a calcified ligament that was irritating and digging into those nerves and putting back pressure so that the cerebral spinal fluid can't drain through the normal pressure gradients, what symptoms do you expect them to have? Can you come closer so you can get a better shot of that? Okay. Well, you're going to have lots of things. So that's not everything that we're seeing. From this view, we can see that both first ribs, instead of being attached up here at their facets, they have come down. You can see how they're hanging off the bone there, and they both are hanging off the bone there. There's a stellate ganglion that sits in there, and the doctors are injecting the stellate with a lidocaine. It's called a stellate ganglion block, and they're doing that for post-traumatic stress disorder because any kind of sympathetic ganglion that's irritated is going to override the parasympathetic and keep them stuck in a fight or flight type of thing. So we have a sympathetic ganglion here that looks like it's in danger, and these half of these nerves that I listed to you are sympathetic in nature. So this is just going to be driving you into overdrive as far as making you irritated and suffering terribly. Okay, now interestingly enough, when you go into left head rotation, the jugular is released and it fills up to its normal size. We did look for rotation. Your atlas does come off of C2 a little too much. There is a paradoxical, actually this side's not paradoxical. This side's paradoxical. When you turn it, when you go into left head rotation, you can see how the atlas is kind of pushing C2 forward. So it's counter rotating right there. The vertebral arteries don't like that. One of the things you notice is that you got warmth up in the neck and the head after we adjusted you. That's typically the vertebral arteries opening up and not being stretched, or anyway, the waveforms, we see a lot of changes in there. So what do we have? The first ribs. We'll put that over there. Actually, we'll bring, yeah, stay center, and I'll move everything to center stage here. Again, right rotation. Oh, the good news is that even though C1 is coming off of C2 a little too much, causing a paradoxical counter rotation there, the rest of them look like they're okay. Yeah, it does move a little too much. We'd like a PRP in that joint capsule. That'd be nice. And Prolo all through the whole neck to tighten it up. The good news is, whether you turn your head to the left or the right, the skull is not rocking off the atlas too much. So actually this odontoid stays right in the center of C1, and the skull does not rock left or right. Beautiful, nice, tight ligaments. That's the most important ligaments to have tight. So that's good. And let's close out. This is the venous phase. So we obviously have some congestion. Yeah, this is the venous. I'm sorry, this is the arterial phase. We were already showing you the venous phase. Just another shot. Let's go back. Let's bring the venous phase back up. And right in here, we have the omohyoid digging in there and causing actually an isthmus in there. So it's like when you put your thumb on a hose, it'll speed up the velocities there. So we did measure the velocities mid-cervical, and then lower cervical. So we saw the high velocities from a pinch jugular vein there, and we saw very low velocities on both the left and the right. Actually, the right doubled in speed after we adjusted your atlas, and that's one of the reasons you're feeling so much better. Let's close that out, and let's bring this up. Okay, these are screenshots we went through showing things to the best of my ability. Venous congestion, and you can just about see where the styloid is digging into the jugular there. Left jugular, right jugular. Actually, the jugular is being pushed towards the midline there. Yeah, there's a good shot of it there. Never seen one do that, by the way. And then when you turn your head, it opens right up. Both of them are not good. And this hyoid bone is twisted and distorted, misaligned in a way I've never seen before. So I only can imagine what kind of constriction or scar tissue, something has pulled this thing down. Is it associated with the thyroidectomy that you had done? I don't know. I think the thyroidectomy was a little too low. I think it was more of that flexion injury, the hyperflexion injury that caused perhaps the hyoid to come down like this, whatever that's invisible that we can't see. We see these calcifications of the stylohyoid ligament as a compensation to something. And I mean, you're between a rock and a hard place there. Yeah, I got another view of that. Yeah, that's a good view where you can see it actually digging into the jugular vein. That can't be right. And then if you do get an accident, hyperflexion, I don't think these soft tissues like that. At least your internal carotids are not in danger from a car accident or anything. Yep, so this is looking from the top or from bottom up, and you can see this hyoid doing a funny thing, and wait till you see what it does with left and right head rotation. Just another view showing how that right dominant jugular vein gets pinched down to nothing, and the left one is right behind it. We drew a line through the center of your foramen magnum, looking for rotation, and it was a little off. We got that adjusted pretty good. Main thing was opening up the right jugular. Another view of that. Yep. Yeah, another view of that left one. Funny shaped hyoid. There's your first ribs down. And your hyoids seem to be following in the same direction. So perhaps the same injury that ripped your ribs from their normal position, pulled this whole anterior compartment down, has yet to be understood. That's going to take a while to figure out, I think. Left and right. Yeah, here's where we're comparing how so it looks like on x-ray that your right C2 is taller than your left, but really it's because this facet is not closing and it stays open on the right side. So you can see how closed it is on the left and open it is on the right, and between C3 and C4 does the same thing. So there's an injury there keeping it, but we don't see a calcification keeping it from going into extension. So it should be able to be fixed. It's probably whatever's going on in the anterior compartment is probably what's keeping this from going into extension there. I don't see anything back there that's hard-boiled and keeping it from going back, which I have seen on other people. I've seen where the joint capsule has gotten so injured that it actually calcifies it and that facet can't go back anymore, and you're not there yet. You're still fixable. You know, some of the ligaments we were talking about, there's that stuck inflection. This is right head rotation. There's a good shot of everything staying where it should be. You can see the right jugular open up to its full normal diameter, and actually so does the left when you turn your head. This is right rotation. Again, right rotation, the atlas doesn't seem to rock around too much, so you're not in danger there. Another good shot of how much it opens. Just right rotation showing the atlas doesn't move too much. The hyoid does a funny thing with right rotation, and wait till you see what it does. Oh, we might as well go show this. This is the ultrasounds. The main thing was right jugular mid-cervical, there's your peak velocity of 43. That's how much blood was coming out. And then right jugular, mid-cervical after the adjustment. Here you can see how much more blood is coming out. It's at 90 centimeters peak. So, I mean, that more than doubled. Well, pretty much doubled. Okay, so that was the beautiful thing. There it is. Left head rotation and right head rotation. Look what happens to this hyoid. I don't understand that, nor do I understand that. Somebody's going to figure that out. Somebody will probably look at that and know exactly what happened to you and what that means. Left head rotation. Yeah, left. These are all left head rotations. Beautiful. Oh, here's a good shot. So left head rotation, you see the jugular opening up, full diameter, and there's neutral position. I can only imagine how that vein feels. It's got to be thickened. There has to be some soft tissue changes from that styloid, hitting it and releasing, hitting it and releasing. Another good shot of that. These are all left head rotations. Look at the different angles. Rotation, neutral. These are comparing neutral and left. Left. This is actually the left side, left head rotation. So you can see the jugular there comparing to neutral. Big difference. This is neutral position. There's rotation. So they're getting crushed and released, crushed and released. And that's everything. So
with a dropped shoulder, we don't really understand yet the venous component of that's causing the Raynaud's syndrome, if that's what's causing the Raynaud's syndrome.
Right. So there's another thing. RSD, reflex sympathetic dystrophy, is what happens when there's an injury that just doesn't seem to get healed. The autonomic nervous system goes into another gear. It just gets stuck, and so you have some of these strains, capillary changes, these Raynaud's, these vascular anomalies. Actually, they'll do infrared imaging to see the temperature changes. So yeah, there's a whole dysautonomia that can be going on, and that's kind of does happen when you have a problem that you haven't found yet. Now, because her first ribs are dropped and her shoulders are down, so that there is, and I know she's had the thoracic outlet ruled out, but I assure you they didn't look at it as deeply as we have today, and there's more than just our first rib, clavicle, crushing the artery, the nerve, or the vein in there, any of that, because you have thoracic. Anyway, we showed some other things in there. Examination. I mean, you got to get in front of more doctors.
And then the calcified styloid actually hitting the atlas. So it's not just pinching and displacing the
jugular vein.
It's
Probably displacing the atlas too. Yeah, it could be. It's kind of a distortion within a distortion. So the main thing is that she has to be able to go back into extension, and C2 is stuck in flexion, and I think it has to do with these styloids pulling it forward like that.
Any symptoms you want to discuss?
No, not really.
The compression of the internal jugular vein clearly is going to cause an intracranial hypertension component. Does that also include obstructing the CFS flow?
The cerebral spinal fluid is not able to drain through the normal channels because of that venous drainage compromise, or at least it's not draining like it should. It's compromised, it's not optimized, and that's a whole cascade of events. So the metabolites of the brain, they are not innocuous stuff, to quote Dr. Damadian. They're inflammatory. We have antibodies that respond to them. So if she's not able to flush out the byproducts of metabolism well, and they start to build up in there, all kinds of things can happen that we still don't understand yet. I mean, there's a lot of things that people are trying to figure out. Visual snow for one, and I don't want to actually mention some of the other anything that's affecting the brain. We all metabolize a little bit differently. So some of our metabolites, our intermediates, can be more inflammatory than others. We can get an immune system that reacts in there. So then the brain really doesn't like it when you're not able to flush well. So nobody can really tell you that this does not cause that when it comes to the brain, when you're backing up stuff like this.
Well, there's clearly a backup with the styloids.
Structure affects function. You look at both jugulars being choked. She has dual exhaust, and both of them are being occluded. That can, and she's got symptoms that you go from doctor to doctor to doctor to doctor, and I mean.
Thank you for what you do.
Okay, good. Okay, good.
Thank you.